Yeah, May 17th, lecture plan is May 17th, so you should be able to pull that one. Okay, now, the shift paper. Did you all receive a copy from Sean of the actual paper?
Not as of yesterday.
That would be 2 or 3 days ago. Okay, is the list server up and running? The list server? Okay, I will send you tonight the shift paper. It's sitting on the website, it's there, everything looks fine. For some reason, it won't open up the link. And the only thing we can suspect possibly is that the version, the Adobe version of the shift paper is in a different version. Anyways, rather than worry about that, I'll send you the shift paper tonight, okay, the actual PDF, okay? So that will be done tonight. Okay, and then the other, now, you'll notice the Alvarez talk and the Manitoba talk are now both on the website, okay? So that's for Thursday's class. So the 2 presentations, the 2 video conference presentations. So if you want to download from your laptop, we'll also project that PowerPoint on a second screen while they're speaking, so that you don't have to necessarily have it from your laptop or print it out. But if you want to print it out and make your notes, then it's available. Okay? All the other presentations, including the ones I'm going to give today, will go on the website right after the class. Okay? So I won't get to work on this until about probably 9 or 9:30 tonight. But when I do that, I'll send you the shift paper, and I'll put today's 3 lectures on the website. Okay? Any other questions? Yes, Alvaro.
Dennis, related to the presentations, question and answers, do we leave it up to the presenter to allow us during the presentation? Or
No, I'd suggest you dive in.
Okay.
I suggest you dive in, and if the presenter, and I don't think any of these presenters are going to be uncomfortable taking questions right away, but if they'll say, I'd rather wait until we finish, okay? So just dive in, okay? Politely dive in. It'll obviously be a lot easier with people who are here physically with us. The video conferences, questions is obviously more difficult. Anything else? No? Okay. Let's move on then to where were we here? Just, okay. There are the group projects. I realized too late, it was too late. I committed myself. I thought the teams were 1, 2, 3, 4, 5, 6, 7, 8. And so the group projects were ABC. And, no, sorry, the other way around. I thought the projects were 1 to 3, and then so I assigned the teams 8. I ended up realizing I ended up using sort of a different set of numbers. I used the same set of characters. So team A is working on topic G, and team B on topic B, team C on topic A, and so on. Okay, so we're well underway with the group projects, and I've talked to a few of you already about that. Okay, for those people who haven't been here before, expectations that you will have read the papers, okay, and the lecturers know which papers you've read, so they hopefully will bring up the paper in the course of the discussions with you. As I said earlier, an active participating class. One proviso. Please try to avoid sort of lengthy background statements before you come to your question, okay? Sometimes we wait for 3, 4, 5 minutes before the question comes out, okay? So you make background statements, that's fine, but keep them very, very brief and make your question and or your comment, okay? So here's one, because again, it's a large group, it's a very large group for a graduate class. But we'd like to try to get as many people involved, and I encourage every one of you to try to please get involved as much as you can. No need to take a lot of notes because all the presentations will be on the website. Okay? Please do learn from each other. Okay, you'll learn probably more from each other than you will from me. okay? Because you have an experience, you have a viewpoint, and you have a knowledge base that will be very helpful to each other. So make sure you take advantage to learn from each other as well, okay? And for those of you, your laptops, keep them connected, because I'm sure once in a while we'll come up with something, we'll say, go and find what the situation is and tell the rest of us, okay? So that's, I don't understand why this classroom is not totally wired. This is one of our newer buildings on campus. I can't believe that the only power outlets are these few up the side here. I mean, I've seen other classrooms at other universities that are older, and there's power outlet, every other seat is a power outlet. Anyways.
Systemic thinking.
Huh?
Systemic thinking.
Well, maybe it's social sciences, and someone from our softer parts of our university are on the planning committee. And we do have colleagues who don't believe in technology. They profess. They come in with no technology. Okay, please turn on your cell phones if you haven't already. Okay, now on to these three topics in a rather quick fashion. So I apologize for that, but we'll do the best we can.
Just a
Yep.
suggestion, I mean, since we unfortunately started a little later, I'm okay if we go a little bit over to sure we get through it once, and if others are.
Okay. I don't mind, so thank you for that, Sherman. Okay, common characteristic of all three of these is that there are many, many, many hidden slides. Okay, I'm not showing all the slides. So if you want to go into it in a little more depth, go in and take a look at the hidden slides. Okay, there's a lot more detail, particularly the Canadian healthcare system one particularly has a lot more hidden slides. So where are we? Canadian healthcare system. Okay, so a quick overview of our Canadian healthcare system. Again, with apologies to those of you who sat through this last year. Please, those of you who sat through it and you have some experiences you'd like to share with us as we talk about things, please pipe in, okay? Those of you who also who are working in the healthcare system, please share with us your views, opinions, and thoughts as we go through this, okay? We'll only cover three parts: a bit of the history of our system, financing, and regionalization, which is probably the most significant aspect of our healthcare system in the last 10 years. Okay, first thing sort of fundamental to our healthcare system is that its origins go back to 1867, and it's a federated health system. Our forefathers, foremothers, I don't think all your mothers involved there in those days. Our forefathers created what's called a federated health system, which means that healthcare is a provincial responsibility. Provincial territory is not a federal responsibility. There are other healthcare systems in the world where it's a national system, there's only one system. England is the most common, okay? But our system, like many other systems in the world, is federated, which means healthcare is devolved down to the provinces and the territories, okay? And that goes back way back. Saskatchewan was our first province to really develop a hospital care plan up until the 40s. I can still remember discussions with my parents when I was very, very young of using goods in kind to pay for health care. So the doctor was paid in so many bales of so many chickens or so many eggs or whatever as a payment for health care. Okay. That changed when we started with the first Hospital Insurance Act in the 50s, where all of a sudden health care was now going to be covered by government. Hospitals, okay? It's not all of healthcare, but it's the hospital. And in 1957, the Hospital Insurance Act came in Canada, and the federal government agreed to pay 50% of all costs, and the provincial government from each province would agree to do 50% as well. And that finally came into effect in all the provinces by 1961. Okay? So it's not that long ago that our healthcare system grew. Big change in 1977. The government changed from a 50-50 funding. The federal government changed from a 50-50 funding formula, where the provinces in effect submitted what they spent in healthcare, and then the government gave them back 50% of that. The federal government gave them back. They changed to a tax point transfer kind of system that was more per capita based, and it was also based on gross national product. In other words, how well is the country doing in terms of producing its economy. And it also, through the money in from education, the federal government's contribution to education also went into this pot. So now it was a health and education pot that the provinces received from the federal government. Okay? So it complicated matters a little bit. It became harder to see where exactly was going into healthcare. So this is an old but still effective picture of what happened, where you can see prior to 1977, federal cost sharing was 50 cents on the dollar. When that came, the new formula came through in 1977, it changed down to about 30% on the dollar. So the federal government began to become even less involved in healthcare because it no longer was paying the same amount. Over the years, that has been dropping and dropping. Okay, and the federal government's contribution has been dropping. 1984, our Canada Health Act was instituted. Okay? Something which a lot of people consider to be the foundation of being Canadian, is we have a Canada Health Act. Okay? And it in effect guaranteed that regardless of where we were in Canada, and regardless of our income level or income status, we would be looked after. Okay? It was also brought in at that time to reduce the extra billing that was going on in some of the provinces, so that some people were being charged more for health care than others. Canada Health wiped that out. Okay? And it had 5 fundamental tenets on which our system is still built, and which, surprisingly, the Canada Health Act, I guess about in the late 90s, early 2000s, there was more and more discussion, should we reopen the Canada Health Act? And particularly look at the question of comprehensiveness as to what's medically necessary. That's the most contentious part of the Canada Health Act, the words medically necessary. And so far that hasn't happened. No political party has decided they want to open that particular box and have a discussion about it. Okay? So we're still operating under an act that guarantees comprehensiveness and guarantees guarantees comprehensive coverage for hospitals and physicians. That's all it's guaranteed. Drugs, not necessarily. Home care, not necessarily. Long-term care, not necessarily. Okay? So that's the part of the act that some people think we should be looking at more carefully. And what happens in those other areas outside of hospitals and physicians is it varies province by province as to how much the province will cover for the individual's care. It varies quite widely. We tried, I guess so it must be 10 years ago now, we tried to develop a national drug